So rheumatoid arthritis is a disease that we start with methotrexate as our first therapy, and the standard of care in the EULAR and ACR guidelines are to treat our patients with methotrexate, and the patients that don't respond or are incomplete responders, we usually add a biologic agent. And the question is which biologic agent to add. We have lots of information compared to placebo, but that's not what we as doctors or the patients really want. So this was the first randomized controlled 2-year trial that was blinded, looking at whether or not in a methotrexate incomplete responder, the standard kind of patient we see in the office and clinic, whether you would think about adding Abatacept or adalimumab. The 1-year data presented a year ago at EULAR, and now the 2-year data here shows us that the efficacy for both agents, both the kinetics of response or how quickly they respond, and the percentage of response is exactly the same. 85% of them in both groups don't have any X-ray progression. So that is really good news for us as clinicians and for our patients. The other important issue is safety, because you really need long-term data for safety. And now we have a 2-year blinded comparative trial looking at safety, and there were fewer withdrawals in the Abatacept plus methotrexate arm versus the adalimumab plus methotrexate arm. And this offers physicians and their patients choices and information and data to make that choice.
Well, now that you've shown equivalency, how do you make the choice?
Well, for efficacy, there's equivalency, and how quickly they respond, there is this equivalency. And there is a little bit of a safety benefit and withdrawal benefit for patients who got Abatacept versus methotrexate. But it allows the clinician then to have multiple choices.
Well, do you make your choice? How do you make that choice, though? Are you looking at patients' baseline characteristics? Are you looking at different comorbidities?
So we hopefully, at the next EULAR Congress, we will have our data where we are looking at what are called biomarkers or specific blood tests to predict who would respond or have a side effect to one of these agents or the other agent on top of the standard of care methotrexate. So please come back next year and ask me that question.